Why do we care about it if our A1C is good? Same thing, most of our patients will ask us, why do we care if we feel so good? We have no issues. And when patients have high sugar, they usually don't feel anything for a long time. They start feeling it when they have either too high of a blood sugar or they develop complications. So today I'm going to talk to you about complications of diabetes and how we can prevent them and manage them. So as we all know, diabetes is a chronic disease which is described as state of raised blood sugar, which is called hyperglycemia. And as we just heard, it reduces your lifespan. It damages most of your body system, especially blood vessels and your nerves. We know about types of diabetes. Mainly there are two types, type 1 and type 2. Type 1, when you don't have insulin, your body loses the ability to make insulin. And type 2 is when body just cannot use the insulin effectively. Next slide, please. So let's begin with short-term effects of diabetes. When someone has diabetes and they are unaware of it, and the first time they come to medical attention is when they are super sick, they are in hospital, they are throwing up, very bad with belly pain and stuff, and then they are diagnosed with something called diabetic ketoacidosis. What happens that your body doesn't have insulin to break down the sugar to give you energy. So it breaks down the fat, and when you break down the fat, it produces ketones in the blood, and which is very deadly at times. Also, short-term effect, if it's uncontrolled, it can cause recurrent or persistent infections. And both high sugars and low sugar can cause coma, and if you leave it untreated, it could be fatal. Next slide, please. So this is the main part of the talk, when I'll be talking about long-term effects of the diabetes. We could classify them into macrovascular and microvascular complications. Macrovascular is mainly when we talk about your heart, your brain. Diabetes, as you know, is equivalent to having a cardiovascular event in past. It's such a big risk factor that we have. And microvascular, when it affects the small blood vessels like your eyes, your kidneys, your feet, everything. Next slide, please. And the key underlying defects that we often see is number one, obesity. I mean, it's so common in here, but when we go to India, even tiniest person from the back will have a belly. That's the kind of diet we use, which Sangeeta will be talking. Also, that belly fat gives us lots of insulin resistance, high blood pressure, high cholesterol. Next slide, please. So going over the microvascular complications. So diabetes is a disease not just of your high blood sugar. It goes to your eye, heart, kidneys, feet, brain, everywhere. So eye problem, it's either retinopathy that we call it, or other issues with your eye like macular edema, glaucoma, cataract. And if we leave it untreated, it could cause even blindness. So as you can see a picture of normal retina and how diabetes changes the retina. The blood vessels, there are newer blood vessels in there. The small white spots are called cottonwool spots. So that's why, next slide please. So how do we manage it? Whenever I see a diabetic patient, the first thing that we have to make sure that they are seeing an eye doctor annually. Type 2 diabetics, at the time of diagnosis, we tell them to see an eye doctor. Couple months later when the sugars are better. Type 1, we can wait up until 5 years from the time of diagnosis. So once a year, dilated eye exam, not just getting their glasses done. That's not enough. They have to have dilated eye exam done. Also, manage the diabetes. Diabetes is key factor. If sugars are uncontrolled, the eye conditions are not going to get better, they're going to get worse. And if we detect them early, we can do photocoagulation, laser treatments, and surgery for cataract. Next slide, please. And food problem, they are the most common cause of amputation after any accident in the US. And because when we have diabetes, it affects our nerves. Roughly speaking, for us to understand, the nerve has a sugar coating on top, so we stop to feel the sensation. And when you don't feel the sensation in your feet, you get a cut or something and you don't feel it for a long time, that gets infected. And even pre-diabetes that we were talking about, somebody who has A1C of less than 6.5, if you have it for 5, 6, even 3, 4 years, and we know how resistant we are, we all Indians, we don't want medicine. So we are all like, okay, my A1C is only 6.3, we don't want it. Even that for 3, 4 years can cause complications, the neuropathy. And how do we manage that once we have it? Patient education is the key. Always, always, I tell my patients, please, when you wake up in the morning, inspect your feet. Keep the feet dry. Area between the toes, especially, keep it dry and put moisturizer all over. Proper gear is very important. We all walk bare feet in our houses. That's the custom that we have. But walking barefoot also kind of predisposes you to lots of cuts that you don't even know about. Special extra wide shoes, deep shoes. Just so you know, our insurance, if anybody is insured in the state of Massachusetts, once a year we are allowed, being diabetic, to have a free pair of shoes through the insurance. So see a foot doctor or get a prescription from your endocrinologist and get your free pair of shoes. They don't look very good, but they're very comfortable. And if somebody already has any kind of ulcer or any kind of lesion in their feet, we like them to have a multidisciplinary approach. We want them to see our podiatrists, we want them to see our wound care doctors. Next slide, please. And renal problem. This is one of the costliest problem or complications of diabetes that we deal with after the heart disease. It could begin as mild protein in the urine to kidney failure needing hemodialysis. Next slide, please. How do we manage that? For this, we have to try our best to get our blood sugar normal, get our blood pressure normal. Every single year, we check the urine for urine microalbumin ratio. That's the smallest amount of protein these tests can detect. And once a year, we do that. Also, there is a group of medication called ACE inhibitor or ARB. Somebody who doesn't have high blood pressure, but they have mild protein in their urine, they are diabetic, we tend to put them on these medications, either lisinopril or losartan. Next slide, please. So, final point about prevention of microvascular complication: control your blood pressure, control your sugar, control your cholesterol. Next slide, please. Just briefly about the major macrovascular problem. One of them is cardiovascular disease. We all are aware of it: angina, heart attack, heart failure. Stroke also when you have less blood supply to the brain. Next slide, please. And how do we prevent it? It's same old boring diet and exercise we have to do. And drugs, there are certain drugs that we use when we are worried about these diseases in diabetics. Next slide, please. Aspirin is one of the most commonly used, baby aspirin, 81 milligrams, sometimes twice the dose. We use it. Only time we are cautious with aspirin is when the risk of bleeding is high. Beta blockers, when somebody has a coronary event or a heart attack or something, we put them on beta blockers for at least 2 years from the time of diagnosis. Diuretics also lower blood pressure, like hydrochlorothiazide. ACE inhibitors, they are again the same group of medication which we talked about to prevent renal complications. Next slide, please. Statins, Dr. Gana just mentioned about statins. They are life-saving drugs. When I was in training, I used to hear from our directors that if it was up to them, they would dissolve statin in city's water and have everybody drink it. So this is such an important medication, and with so many things that's coming out, statin can cause this and that, and I have to say, whatever it is, if it's a risk of diabetes, if it's a risk of cognitive disorder, the benefit that you get from statin is 10 times more than any of these theoretical side effects that you can get. Next slide, please. So one of the last slides I have, in diabetes, it's a growing threat. 70 to 80% of people with diabetes die of cardiovascular disease. For each risk factor present, the risk of cardiovascular death is about 3 times greater in people with diabetes as compared to people without diabetes. It's the leading cause of blindness and visual impairment in adults. It's most common cause of amputation, which is not the result of an accident. People with diabetes are 15 to 40 times more likely to require a lower limb amputation compared to the general population. And most people with diabetes, many with diabetes, develop severe kidney disease. Next slide, please. So this is just figuratively summarizing all the complications of diabetes. Almost every organ of the body can get affected if you have uncontrolled sugar for a long period of time. Next slide. And this is the last slide. Just to remember something, if you can, what we see is ABC of diabetes. I just added ABCDEF of diabetes. A stands for your A1C, which is average of your blood sugar for past 90 days. And the target is less than 7%. Target changes based on patient's age, patient's condition. Pregnant patients, we have much lower target. Older patients, we have easier targets. We go by their age. B stands for blood pressure. The target for that is below 140/90. Once again, that changes. If you have somebody with kidney disease or prior heart attack, we like to have slightly lower blood pressure. C stands for cholesterol, LDL level, that should be below 100. And like we just heard that in diabetics we have low HDL, high triglycerides, that also needs to be controlled. And no talk is going to be complete without diet and exercise and lose weight, lose weight, lose weight. My husband always says to lose weight, just have to put a tape on your mouth and then that's it, you will lose weight. And E stands for eye care. Once a year eye exam for all our diabetics is essential. F stands for foot care, where self-education, patient education is very, very important. And I just added the S. If you're smoking, please stop smoking. That's it. And thank you very much.
Thank you so